Hey, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation. And today we are here at ATA 2022 and I'm checking in with the head of enterprise virtual care for CVS Health. Please meet Dr. Creagh Milford. Good to talk to you.
Thank you.
Ooh, CVS, virtual care. Where to start? Let's start high level. I think everybody, obviously knows that CVS is in this virtual care space. You're augmenting the care that you're delivering in your in-person pharmacies and stores and in retail centers with virtual. But tell me, head of virtual care, how are you guys thinking about virtual and how it fits in with what you guys are doing in person?
Yeah, great question. So we've got a lot going on. So virtual care covers the gambit of a lot of different services: urgent care, virtual primary care, the home-based services, how we're bringing virtual to those areas of our existing businesses. And we think about virtual in a couple ways. One, the fact that our existing businesses are delivering a lot of in-person care, as you said, Minute Clinic and others. But what's a little known fact is that, by way of example, Minute Clinic still is driving hundreds of thousands of virtual visits per year. Aetna, by way of another example, has actually been piloting virtual care benefits and programs with other partners, both in the primary care and urgent care, and actually specialty care space for almost a decade. And so, how we're beginning to think about it is a couple of things. One, how do you create a connected ecosystem so that the consumer has a single front door of healthcare? The second is, from a provider lens, how do you ensure that provider workforce is coordinated and working together? We've got a lot of different parts of our businesses, from pharmacists to Minute Clinic into aspirations around primary care and so forth. And being able to stitch all of that together in a connected experience is really important. We're advantaged in a lot of ways because we use a single electronic health record and we have a data system that allows us to see patients in one view. But those are how we're kind of starting to think about weaving together the existing business models with virtual, recognizing exactly as you said, recognized by the ATA conference here today, care will likely move much more towards even a hybrid or all virtual approach. We think virtual only is something that is not going to be as readily adopted moving forward. But as we think about the models we currently have, which is largely in person with demonstrations of virtual, being able to really connect that together from a digital, virtual, in-person, home experience all together will be kind of where we're going to be strategizing the next couple of weeks and months.
I love that. So I think you're not alone in doing that, because I feel like I keep hearing, I think omni-channel is the word of the last 2 years, as I think healthcare organizations like yourself and other provider organizations are trying to think about what is it that we do take and turn virtual, and what is it that does need to happen in person, and what's that mix, and then how do the workflows around that change? So you even said, we're thinking through how to get this one point of entry for the patient, for the consumer. Can you take any of that any further and maybe reveal to us some of the questions that you're asking yourself as you're kind of going through and strategizing this stuff? What are some of the things that are keeping you awake at night, Creagh?
Well, we're really trying to, it was unbeknownst to me until I joined CVS, but CVS.com is a very well visited, prominent healthcare site. People are coming there to get all sorts of questions answered to their care, and they're also going there to see where the local Minute Clinic is and see where the local retail is and fill my medicines. And so if you think about that as a forum for the patients that we serve and the members and consumers that we serve, how do we begin to build that into a virtual and digital strategy where you can also actually get care? But to do that, you need, number one, what we call air traffic control systems in place below your digital strategy to help inform that consumer of where the right time, place, person, specialty, and so forth are available. And then second is have the care teams present and ready for when that virtual visit is going to occur. And then the third part, I think what has been challenged in the past with a lot of these virtual models and physical models is tying it together so that in the event that a patient ends up with a virtual provider and needs in-person care, that we've transitioned that care appropriately with a single care plan. And each of those steps involve a lot of clinical operations, a lot of overall operations. And so we think a lot about those kind of pivot points of how a consumer and a provider end up having to meet within the ecosystem, and then be scheduled into that appropriate appointment, but also referred into the right care that they need. So those are kind of the steps below generally kind of connecting a patient and a provider together virtually.
So you had mentioned like between CVS and Aetna, a lot of experience with virtual care. How has the way that you're looking at it, looking forward at that strategy that you're developing? I mean, we're talking about the nuts and bolts here and like what we're going to do next, but I'd like to know like how the pandemic has changed, if it's changed, the way that your organization is viewing virtual at all. Like, I mean, because I've had a lot of discussions, at least early on in the pandemic, about like, toothpaste out of the tube. Now everybody's tried it, that you can't get it back in. I mean, are you guys feeling the same vibe there? Or like, talk to me about how the pandemic has changed maybe your approach to virtual.
I think it's very common now that we have a lot of virtual. Pre-pandemic, you had basically a virtual-only approach, and most of your in-network providers were doing just regular in-person visits. We then saw an explosion across the board, specialists and primary care in-network providers that were now doing virtual visits. We've seen that trend kind of recede a little bit over the past, kind of months. And I think that we'll reach a steady state around how providers in the network and then companies that are, really approaching payers and providers to be able to deliver kind of these virtual and in-person options for their membership. So I do think it will persist in terms of the virtual trend. Mm-hmm. I think that certain areas will actually be, I think, higher utilizing than others. Behavioral health we've seen over and over. That continues to be a trend in an area where digital experience with patients actually has been driving a lot of change. But I think a couple things will play out. Number one, consumers have voted basically with their feet or with their fingertips that they're going to want a virtual experience, mainly because of access and convenience for them. I think we're still trying to prove out collectively as an industry the implications on quality and on cost. I think those are questions that we've had early indications in some models that there's improved quality and lower cost. But I think as these models continue to evolve and, quite frankly, connect back better into the local communities, my expectation is that we hope to see better quality and lower cost as a result of those programs. And I think what will be interesting is as we ease out of the pandemic, hopefully, fingers crossed, to what extent the in-network providers will continue to do virtual care as a part of their core practice. We've seen certain areas, pre-op, post-op, for the surgical side, becoming more virtualized as a standard. I think in the general medicine and general specialty categories, I think the question is, how does that virtual component of care actually nest within their overall business model? Because today, most providers in the network are paid fee for service and get paid more for doing more. And so how we think about changing those business models and financial models will be really important to actually create more traction, more acceptance, more adoption of virtual as a real way to entice patients back to their primary care doctor, back to their specialists, and so forth. So I think those are the areas that we're really trying to think through with respect to the clinical, the business, and the financial models.
On the financial model, do you think the incentives are going to realign?
Sure hope so. We've seen a lot of opportunity with the value-based models, MSSP, now direct contracting, and ACO models within the commercial space. We have clear evidence in the Medicare Advantage space that if you put the right types of incentives for providers to accept risk, manage patients, that you get better outcomes. And so my hope and expectation is that we'll have more and more companies, including CVS, that will begin to point the way for how to evolve some of those value-based models. And ideally, virtual then becomes a very key part of that business because it drives better engagement. As I've told our team many times, we still live in a world where we want patients to come to the doctor. I'm still practicing internal medicine doctor. And we need to move to a world where it's more omni-channel. They can connect with us and I can connect with them in a very different way. more proactive than reactive, right? More longitudinal than episodic. And so as we think through how we're going to do that, I think those value-based financial models will actually help accelerate that work. And you've seen that, again, in some of the other areas like Medicare Advantage. Some early models around exchange and the MCO Medicaid space.
All right, last thing for you. What do you got your eye on? Like, what's cool to you from a tech standpoint? Like, I mean, like you're probably seeing all manner of stuff. In fact, I know all manner of health tech and digital health company that is, trying to work with CVS Health and with Aetna. And so, like, what do you like? What's got your attention peaked? I mean, like, are you into any particular category of health tech, or are there certain things that you're looking for to kind of augment or build out what you've already got going on here?
Yeah, I think there's several.
Okay. I keep going.
One is, we collectively at CVS see a huge opportunity in the home. And so businesses that are really innovating and delivering care differently in the home, we're really excited about. The use of technology and wearables and sensors, we're here at ATA, there's several companies that are in that space that really, I don't know who will be the winners in that space, but what we're interested in is how do you connect the data device? How do you use it to deliver better care, more real time, more continuous? So, those models and those devices will help drive some of these more higher acuity models in the home, like hospital at home and post-acute care at home. So that's the second area is devices. And then, we're looking at, along the digital and AI side, how do we all start to think about the use of AI and the use of really optimizing management by exception. So we're going to have a lot more data, a lot more interaction and touch points with patients and members across, in our instance, the CVS ecosystem. How do we use AI to help that patient better get care? How do we use that AI to help the care team actually deliver better care and interact at the right times? And then finally, how do we use AI on the back end administrative work to improve administrative burden or reduce administrative burden for the providers that we help and work with across the spectrum? So those are probably a couple areas that we are looking at.
Awesome. Well, I love that provider focus from a doctor here. I love it. Thank you so much for stopping by and talking with me. It's exciting to run into you here at ATA, and so I appreciate you taking a few minutes to tell me what's up at CVS Health. Thank you.
Thank you.
All right, everybody, that's Dr. Creagh Milford. He is the head of enterprise virtual care at CVS Health, getting us up to speed on how CVS Health is thinking about their virtual care strategy moving forward. Thank you again for stopping by.
Thank you.
I'm Jessica DeMassa, and for more interviews with the who's who of health tech as they are changing the way that we do healthcare, head on over to my YouTube channel. It's youtube.com/WTF Health. Thanks.